My name is Mike Omotosho. Introducing myself is usually a bit difficult because I have people introduce me. However, I'll give it a shot. I can definitely say Mike is a husband, a father of four amazing children, two boys and two girls. I am a passionate humanitarian and also an advocate for quality healthcare and good governance. As per my training, I graduated as a pharmacist in the year 1990. I also have an international MBA and an executive certificate in leadership from the famous Harvard Business School. I am the Governor Emeritus of Rotary International, covering all of the West African states. Rotary International, as you know, is one of the foremost humanitarian organizations globally. Similarly, I am the pioneer district governor of Toastmasters International District 9125. I serve as the co-chair of the Community Advisory Board of Mount Sinai Cancer Equity Accelerator program. And I'm also a proud citizen scientist with the Protocol Review and Monitoring Committee of the Tisch Cancer Institute. For me, advanced care planning is planning ahead for what health decisions I want to make in a situation that I cannot make those decisions myself, either due to mental or physical incapacities. That way, my choices, my preferred choices, are adequately documented and my wishes are fulfilled, even though I'm not able to make those decisions at that time. It never really occurred to me to take advanced care planning and appointing a health proxy seriously, though I had always tinkered with my medical preferences. For instance, I'd always hinted to my spouse about being a donor organ, and I'd also insisted, even though subtly, that I would prefer to be cremated and by my ashes stored in an exotic gold urn. However, the craniotomy that I had last month caught me unexpectedly and made me sit my healthcare proxy down to intentionally discuss my medical preferences in a situation where I am unable to make such decisions. That's a very interesting question. I say so because in my culture, it is a taboo to plan for one's demise ahead of time. Unfortunately, I have seen so many families end up in despair due to disagreements on how to honor a loved one's last wishes. So I can understand why a number of people will be reluctant. Consequently, my advice will be that if you do not want your story told wrongly, or told by somebody else for that matter, you must tell your story yourself when you can. Now that you're strong, hale, and healthy, decide what your advanced care plan is and appoint a proxy. It is obviously imperative that we decide what our health plan preferences are and ensure that they are adequately documented for implementation should the need arise. My health proxy is a family member because I believe she has the objectivity and emotional temerity to fulfill my wishes. My advice will be to seek out a trusted and reliable family, friend, or an ally who is strong enough to ensure that terminal healthcare wishes are fulfilled. But in the case of limited support, if you can't find that within your family, friend, and ally, I will strongly recommend that you seek a professional healthcare proxy. That will be my strongest suggestion. But in any case, ensure that you have a proxy and you have an advanced care plan in place. I say most of the things that we're afraid of seldom happen. So I'll tell people that the discussion about death should be brought up well ahead of time and not just when one is faced with a terminal disease. And it should be done in a place that is casual and safe, preferably away from the hospital, where you're relaxed and can talk convivially. Death is inevitable for everybody. Indeed, it is an opportunity to think and plan about death ahead of time when you have the opportunity to. So we shouldn't take that opportunity for granted for those of us that have the opportunity. If my spouse or closest ally, for instance, is scared, I will still calmly discuss with her, but enlist the services of a professional healthcare proxy for my advanced care plan. More importantly, like I said earlier on, statistics have shown that almost 85% of our fears never become a reality. However, it is better to be prepared than be sorry we did not. So it's imperative to appoint a healthcare proxy and also get an advanced care plan in place. Thank you.